This is the second page of the Accuplacer Accommodations Request Packet. It covers professional disability documentation requirements. Please note that students are responsible for gathering and submitting clinical documentation. The first step is qualification guidelines. This first category goes into, first of all, the themes that professional documentation must address. First of all, diagnosis must be stated. Second of all, assessment. The diagnosis must have been made as a result of assessment. Method, results, and interpretation of that assessment will be evaluated. We're also looking for symptoms based on that are related to the diagnosis. What are the characteristics, the severity, the duration, the frequency, the triggers, etc. The more we can understand about the symptoms, these are actually the components that we're looking at accommodating. So the more detail we have, the more understanding we have, the more measures we have about them, the more effective the accommodations can be. Finally, another qualification, or excuse me, another theme is the effects and supports. So specifically understanding how the disabilities affected your academics. Recommended accommodations are helpful. A history of accommodations that have been used and work, and those that don't work. Strengths and weaknesses, many times as part of the assessment and evaluation process. The symptoms effects on academics. Recommendations, academic limitations of the student, accommodations history, etc. Any of the additional information that's known about how the accommodation or how the disability affects the student in school, and about what has been done to address and help is helpful. Next is validation of professional documentation. So it needs to be written on official letterhead, include the professional's credentials, and a physical signature of the professional. Next section, neurocognitive tests must cover the following domains: complex attention, executive function, learning and memory, language, perceptual motor, and social cognition. These are all areas of measure that are important for understanding learning. The next category is the age of professional documentation. Neurocognitive tests must be no more than 3 years old. Intelligence tests, achievement aptitude tests, clinical tests, personality tests, behavioral tests, psychoeducational evaluations must be no more than 5 years old. Physician and therapist letters must be dated no more than 1 month from the accommodation request date. The second category we're looking at is types of clinical documentation. These are not an exhaustive list of disability documentation, but just the most common ones. The first is a full and independent evaluation. We call it FIE in Texas. Other states may vary. Some may call it an independent educational evaluation, or IEE for that. This report is a report of diagnosis, psychological cognitive assessment, and evaluation results from the school district. A psychoeducational evaluation must be in-depth tests and not screens. This is something that is basically what the school district would have, but it was just done personally, privately. It wasn't done through the school district. Another is a psychological or psychiatric evaluation in diagnosis reports, supported with testing results administered by a qualified professional. Another category or type of documentation is physician's or therapist letter. This is all depending on the nature of the disability. Third and final category, types of supplementary documentation for academic institutions. These documents are helpful but do not contain all the information required most of the time. First is an IEP, individualized evaluation plans, can provide a list of recommended accommodations, but will not serve as official diagnosis documentation. An FIE, IEE will be needed. See the clinical documentation above to understand what that is. 504 plans are another one. They also list disability accommodations, but we need to have more than just that. We need to have evaluations as well. School districts will have copies of those usually. Our reports, those as well, provide accommodation lists, but they do not provide diagnosis. We will still need the FIE or the IEE for that as well. This ends page 2.